Hi, I'm Dr. Bill Keck. This video is about the two different cultures that exist when you talk about academic health departments, melding academia and public health. They really are quite distinct. So today, in this video, let's talk about the academic side itself and what the particular issues are that are relevant. After all, remember that academics are intellectually focused. Their major reason for being is to develop new knowledge and to teach it to others, and sometimes to provide service to their communities. And they tend to have advanced degrees. They'll have master's degrees, doctoral degrees, and they'll be focused on what it takes to maintain their presence and their place in their academic institution, which means they may have to earn some of their own income through grants and contracts, and they certainly have to meet the performance expectations that their superiors set for them, because they're focused on getting from one position to another. That is, advancing in rank from assistant through associate, eventually to full professor. In most cases, there's a time limit for them to do that, and there are very specific things that are expected of them during that process. The same applies to the promotion and tenure that's related to those subjects. Understand that while they're focused on research and trying to get money to support it, anything they produce generally goes through peer review. That is, their colleagues will look at this material and make sure that it makes sense. So they are focused really on taking their time to get everything just right, to be sure that they understand the strengths and weaknesses of what they do, and to be able to explain that to anyone else who questions it. They also work in an environment now where they need to be accredited, particularly if they're a school of public health or a program of public health, or really any academic institution needs accreditation on some level. So there are things they have to do to meet the accrediting body's needs, and they will focus on that because their future depends on it. To do their research, they may need access to community data. That's something to keep in mind if you're a practitioner, because they may need to partner in order to get access to that information and get research that's meaningful. For teaching, they often will need to think about bringing in practitioners to actually teach at the institution, or to allow students to come to experience some work in a practice setting. And their resources are diminishing. Just like public health, although not to the same degree, they're working in an environment that shows resources diminishing. So that's generally the setup there. In the next video, we'll talk about the characteristics of a public health department.